exactly at 10 o'clock. So we are waiting for a while. But I would like to inform you that all speakers have been available, have presented here. So don't worry, they are going to share their experiences dealing with how to handle COVID-19 in their own countries, their respective countries. You see that this is something like global matter. It is the problem of all the world, the whole the world. Okay. Again, I would like to say you welcome, and we are very great, and it is our great honor and privilege to be with you together in this webinar. 5 minutes before we
I-mute,
start, I would
naka-mute,
like to
i-mute
give you
lang.
some webinar, but not about 5 minutes. I think now we are at 10 to 10. So so we have different speakers from different countries, and of course different experiences how to handle uh, COVID-19. You know, in my country today we have about three 30,000 infected, 30,000 infected, and I don't know in your own country, but this is the thing that my updated uh, info about this. Okay, I think now the time for me to give you the rules of this webinar. My beloved participants, some rules of this webinar are as follows. One, all participants should mute the mic of the computer or other devices during the webinar. Again, I would like to repeat that all participants are requested and even should mute the mic of the computer or other devices during the webinar. Now, the participants are suggested to stay in the meeting room, not in out the meeting room, so that it will not disturb. Then number three, the questions are sent by chat. The moderator will deliver the questions to the speakers, and the speakers will answer. Number four, we remain giving opportunities, we still give opportunities of direct questions for two persons in one session. If it is possible, there will be more than one sessions, but every session will be only two persons, and it is better if from different countries, so that they can share their experience in their country for each person, each session. Number five, the moderator has the right to remove the participants who do not follow the rules. For example, who to make disturbance or something like this, noise, and so on and so on. Number six, the committee asks permission to record the entire process of the webinar. Ladies and gentlemen, the participants, I would like to inform you that there are more than 1,100 participants here, whereas our capacity is only 500. So you who cannot, or your friends, besides something like this, who cannot join us, would you like to tell them that they can use the line of the YouTube? And the line has been sent through the to the WA, watch up or something like this by the committee. Okay. Again, I would like to tell you that the capacity is only 500, whereas the participants registered are more than 1,100. That is why the rest of the 500 can channel to YouTube. Yeah, at YouTube, and the line has been sent. Thank you very much. Thank you and enjoy your webinar. Okay. Now we are coming to 10 o'clock Indonesian time. I mean, we have Jakarta time. And then is it better for us to start now? Okay. Ladies and gentlemen, sisters and brothers, again, I have to say that it is my great honor to welcome you to my university, Sugio Pranoto Catholic University, Semarang, Indonesia, particularly Law Master Program of this university. And we know, all of us, that COVID-19 is a world matter, a world phenomenon. Every individual, no exceptions, should face difficulties, worries, and even fears because of this pandemic disease. So does every country in the world, yours and mine. You know, no matter the country is rich or poor, developed, developing, or even underdeveloped, you know, face this matter, this problem. This disease is truly experienced by all. Ladies and gentlemen, if we feel now we are having a World War III, but our enemy is invisible, and it is more difficult rather than to have, for example, visible enemies. But now our enemies are too small, very tiny, and invisible. Okay. And today we are going to have a webinar on strategy and state policy in handling COVID-19. We are going to share our experiences. You know? This webinar will last from about 2 hours, and there will be 4 speakers here. That is Prof. David Bamford from Flinders University. Hello, Mr. David. Okay. From School of Law, Flinders University.
Good morning.
Good morning,
Good
everyone.
morning. Morning.
Okay. We go on. Sorry for the trouble.
Okay.
Sorry. You listen to
Good
me, right?
morning.
So I would like to
Morning.
repeat. Okay, morning.
Good morning.
Good morning.
Okay, good morning. I would like to. Okay, uh, okay, ladies and gentlemen, I would repeat. Sorry for the troubles, technical troubles. Okay, so we are going to have 4 speaker here from David Bamford from School of Law, Flinders University, South Australia. Number 2 is Dr. Sheila M. Trahira from College of Nursing, University of Saint LaSalle, Bacolod, the Philippines. Number 3 is Dr. Shi Chia from School of Law, Tunghai University, Taichung, Taiwan. And number 4, Dr. Endang Wahyati, Master Program of Head Law Studies of Sugio Pranoto Catholic University, Semarang, Indonesia. The order will be, the order of speaking will be Professor David first. Number 2 is Dr. Trahira from the Philippines. Number 3 is Dr. Endang Wahyati from Indonesia. And the last speaker will be Dr. Shi. Mulai? Okay, sorry again for the trouble. So we are going to, I'm going to tell you about the order of speakers. The first is from Flinders University, Professor David Benford. Number two is from the Philippines, Dr. Trahira. And number three is from Indonesia, Dr. Wahyati. And number four, the last speaker, will be from Taiwan, Dr. Shi. Why Taiwan is put at the end? Because Taiwan will tell about the success story, how to handle COVID-19 in its country. I think it is necessary for us to see this. Okay. Now we are going to start our webinar, and before that, I would like to invite our dean, the faculty of law, the faculty of law and communication, Dr. Marcela Elvira Simanjuta, to deliver a welcome speech. Okay, Dr. Marcela, please.
Well, thank you, Mr. Herman Mancasiwi, the moderator, for your kind introduction. Okay, I will read my speech, so it will be colleagues, friends, ladies, and gentlemen. Before giving my very brief opening speech, may I extend a warmest welcome to you all to this webinar. Selamat pagi dan salam sejahtera untuk kita semua. May I also extend a warmest welcome to the participants who could not join the webinar directly and have to listen to it only via our YouTube live streaming. Please do accept my deepest apologies. The quota of this meeting is only prepared for 500 persons. Meanwhile, the total number of participants registered have reached more than 1,100 persons. The participants of this webinar comes from 8 countries and also comes from very different occupation. There are doctors, lawyers, nurses, even housewives. Speaker, colleague, and friends, we are in the middle of unprecedented times in our human history, where an infectious disease called COVID-19 has profoundly changed the way we live, not only locally, but also globally. As we know, the COVID-19 has profoundly changed the way we live, not only locally, but globally. The COVID-19 has spread around the world, affecting every aspect of life and also affecting community directly or indirectly. Worldwide, according to WHO, the pandemic has been affecting around 260 countries, areas, or territories. Confirmed cases has reached more than 6.5 million, and that's more than 386,000 people. To quote the statement of the UN Secretary General at the end of May 2020, the COVID-19 pandemic will cause unimaginable devastation and suffering around the world, giving a push into extreme poverty and around 1.6 billion people, especially informal economy workers, which nearly half of the globe workforce without livelihoods. We could see that the COVID-19 hits the hardest among other to the poorest. Undeniably, the least developed countries or developing countries have to face greater risk. Speaker, colleagues, and friends, state has an obligation not only morally, but also legally to protect its citizens. How individual country responds, including making strategies and policies, are critical in influencing the trajectory of these international pandemics. A strict public health and social measures have been done by all countries to slow the spread of COVID-19. These include limitation on domestic and international travel, social distancing or stay-at-home orders, closing of schools, offices, malls and shops, even religious centers. Some countries make very rigid and strict policies and regulation, including lockdown policy, but some have more loose policies. This seminar is expected to provide some information sharing dealing with the ways of how the state have made their efforts to handle COVID-19 and the multidimensional crisis appearing caused by the disease. In some countries, the COVID outbreak is also affecting litigation in various ways, ranging from an increase of use remote hearings, consolidating the courts and tribunals into fewer buildings, to general court closures. Today, we are going to hear our 4 respective speakers from Australia, the Philippines, Indonesia, and Taiwan, describing their particular national strategies and policies, including some legal and or operational instruments in their respective states in handling the disease. For this, in this remarkable occasion, may I give a deep appreciation to Prof. David Bamford from School of Law of Flinders University, Adelaide, South Australia, Dr. Sheila Trahera from College of Nursing, University of St. Lasal, Bacolod, the Philippines, Dr. Endang Wahyati Justina from Faculty of Law and Communication, Sugio Pranto Catholic University, Indonesia, and Dr. Si Chiali from School of Law of Tung Hai University, Taiwan. To conclude this opening speech, I think we all know that this pandemic is far from over, and we do not have an answer for this. Although many of us are anxious and asking, when will this or things get better or get back to normal? We don't know, as life may not be the same after the COVID-19. Once again, on behalf of the Center for Health Law Study, Faculty of Law and Communication of Sugio Pranoto Catholic University, may I especially again say thank to all the distinguished speakers and participants for your participation in this webinar. And last but not least, my very deep appreciation also to all the committee and my awesome and remarkable students from Health Law Master Program for their hard work preparing this webinar. I hope you will find this webinar both rewarding and enjoyable. Thank you and salam sejahtera untuk kita semua. Have a joy in the webinar. Thank you.
Thank you, Dr. Marcela. Now we are to come to the main program of our today, namely the webinar itself. Now we would like to invite the speakers. The first will be Professor David Bamford from School of Law, Flinders University, South Australia. Mr. David, you have time about 15 minutes, please.
Thank you very much, Mr. Moderator. It's a pleasure to be with you this morning, and my congratulations to the organisers and to the participants for being involved. If I can have my first slide, please. I don't see a slide yet. I'm sorry, folks. Well, perhaps I'll begin while we wait for the slides to catch up with me. Can you hear me all right, Herman?
Not yet, but it is being done by the host. Okay.
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 I'll start speaking and we can catch up later.
Okay.
All right. Thank you very much. My brief presentation is going to cover 2 themes. Firstly, how Australia has responded to the COVID crisis, and then how the justice system has also responded to the COVID crisis here in Australia. Thank you very much. I see the slide now. Okay, next slide, please. First, some context for you. As you all know, Australia is a large island country, and that's had a significant impact upon the way we have responded to COVID-19. By way of government, we have a federal government system with a national government, 6 state governments, and 2 territory governments. The national government, as you can imagine, deals with matters of slides coming. Basically, the national system divides power between the states.
Yeah. Sorry, Mr. Demper. We had a problem just now. Would you like to repeat for a while your presentation?
Yep.
Yeah. Thank you.
Okay. So as I was saying, basically the government is divided between national and state and territories. The national government has national affairs. The state governments actually have control of sorry, that slide I've got now. Yes, thank you for the slide. This slide you have now is actually I'll explain in a moment, but the state and territory governments control matters of daily life. For example, education and schools, criminal law, and also importantly for COVID, health and welfare services. So they are not national government, they are state government or provincial responsibilities. So what this means is there's a great need for cooperation between the different levels of government. But it also means that differences
Hilang suaranya.
Sorry, Mr. Your microphone, please.
Sorry. You there? Yep. So there are many parts of Australia which are now moving to have protests about Black Deaths, police conduct in America, and also here in Australia. In some states, those protests are banned because of public health concerns. In some states, like my state, the police have said they can proceed with the demonstration. So different laws are applying in different parts of Australia. One of the big new radical things that has happened as a result of COVID is called the National Cabinet. And this is basically a group of all the Prime Minister, the National Prime Minister, and the heads of every state and territory government. This is interesting because it's not created by law. It's not in the Constitution. It's something that's been created to deal with the COVID crisis. And this National Cabinet is advised by a group of public health professionals. That there's a National Chief Medical Officer, and each state and territory has a Chief Medical Officer. and they are advising the National Cabinet. But the National Cabinet cannot make laws. All they can do is create general guidelines so that, and then each state and territory will decide whether they will, how much they will apply the guidelines depending on the number of COVID cases they have. So, for example, in my state of South Australia, we never had a complete lockdown because we have a small number of cases. But in Sydney and Melbourne, they have much stronger lockdowns than we do. But so, big variety across Australia. Australia has done very well in responding to COVID. And one of the reasons is because we moved very quickly. So just a quick timeline. We started screening travellers from China in late January. Then we began banning travellers from China on 5 February. And that was a person on a cruise ship, which was tied up in Yokohama, Japan. And they flew back to Australia and died. Then on March the 16th, the governments started bringing in lockdowns and shutdowns. And again, these varied from state to state, but there was some commonality. So for example, you couldn't, if you had a wedding, you could have no more than 5 people. If there was a funeral, you could have no more than 10 people. In some places, the law said you could not go out of your house except for shopping and essential services or medicine. In some states, it was only a guideline. So there, but you can see there was a big lockdown of businesses as well. From 18th and 19th of March, Australians were told not to leave Australia, and all incoming travel was stopped for non-residents. And anybody who arrived was required to go into 14 days quarantine or isolation. And so they have been the key strategies that they've developed. Next slide, please. To deal with the consequences of all these shutdowns I've just been talking about, the government, the national government, because it controls the taxes, decided on a major economic package of stimulus from mid-March. So, for example, the government is now paying every business $750 per week for their employees, for each employee, if they've suffered financial loss from the lockdown or closures. The banks have also been asked to suspend those who have borrowed money from banks don't have to repay the money for 6 months. People, landlords, people who own houses which they rent to other people have been told they cannot evict the tenants if they cannot pay their rent because of COVID. So people are able to stay in their house. For business leaders and business managers. But all these are temporary provisions that will last until September 2020, unless they are stopped before then. So the actual amount, Australia has spent something like $259 billion, about 14% of GDP in economic support to deal with the COVID crisis. This is a major increase in government debt to deal with the government crisis. Next slide, please. So that's what we've been doing. What's the results? I apologize, it's a detailed graphic, but just to illustrate, in Australia, we've had something like in the top left-hand corner, 7,240 cases and only 102 deaths. In my state of South Australia, we've only had 4 deaths from COVID so far. At the moment in Australia, there are 4 people in ICU and 23 admitted to hospital. So you can see the number of cases now is very low. Excuse me. The graph in the middle on the top shows the number no, can you stay on the slide, please? Yep. The graph in the middle shows the number of cases, and the biggest peak was in about the last 2 weeks of March. Since at the beginning of April, the cases have been declining enormously. The final thing I want to mention on this slide is that of the cases in Australia, 62% have been people returning from overseas. Another 28% are people who have got it from people returning overseas. In other words, family or contacts from returned travelers. So 90% of the cases in Australia are coming from overseas people returning to Australia. And there's 10% which they're still investigating and trying to find sources of transmission. So as you can see, Australia has been very lucky in its isolation and in its quick response. In the remaining couple of minutes I've got left to me, I want to move on to talk about how our legal system and courts in particular are responding to the COVID situation. Next slide, please. So my first point about Australian courts in the time of COVID is that the way what courts are doing is now changing with the decline in the numbers of COVID cases. Initially, there was an almost total shutdown for all but urgent cases. But as the number of COVID cases falls away, courts are starting to reopen and resume their business more and more. However, as many of you will know, Australia is part of the English legal tradition, and we use juries for some kinds of cases. In Australia at the moment, we only use juries, that's lay people, in serious criminal cases. And of course, with the arrival of COVID and the need for physical isolation and social isolation, basically all jury trials stopped. And in many states and jurisdictions, they have not started and are only starting to resume now. So there's been almost no serious criminal cases heard in our courts. Most of those defendants are actually in jail, so they are just waiting in jail to have their cases heard. In the civil cases in Australia, they are almost all heard by a single judge. No jury, no other judges, just one judge. So basically, they were able to resume much more quickly, and in some places didn't close down. And that's particularly true in the higher courts. But they have made some big changes in the way they do things. The lower courts have had a more difficult time. And that's partly because, of course, they have most of the cases. And so what they've been doing is deferring most of the ordinary cases they would usually hear and only hearing the urgent or critical cases. And so that's the pattern at the moment, is the higher courts are going back to work in the civil cases and beginning some jury trials in the serious criminal cases. And the lower courts have been operating all the time, but only focusing on the really critical cases or urgent cases as such. So next slide, please. So our last slide, and to finish off, the important thing I want to mention to you is that while the work of the courts has resumed, the way they are doing things has changed dramatically. The big move is we have moved to electronic hearings and electronic filing of papers and electronic transmission of papers. Almost all procedural hearings in a case are now decided on the documents. If an oral hearing is required, then it is done by telephone or video conference. And as I say, this has had a big impact on the way in which lawyers and judges work. There's also been a big difference here between the higher and lower courts. Because Australia is a very big country, our higher courts cover wide areas, and they have, over the last 10 years, been developing video conferencing and technology. So it was much easier for them to transition in the times of COVID to move all their work online. The lower courts, of course, are local, so they don't need to have video conferencing or telephone conferencing in the same way. And as a result, they have much poorer technology. And that is one of the reasons why they are having a much more difficult time working in this time of COVID. So overall, in summary, Australia has been very lucky because of its geographical isolation, the speedy response of the governments, which has meant our number of cases is very low. In the courts, we've also responded quickly, but things are slowly returning to normal. But I believe the way we do things will never change. Will never go back to the way they were. Electronic conferencing and use of technology is here to stay, and lawyers and judges are going to have to adapt to that in their work.
Sorry for the disturbance again. Mr. Bamford, would you like to have a concluding remark, please? Because there is a disturbance. Yeah.
Sure, Daka. As I said, basically, if I could just repeat my concluding remarks for those who missed it, what I was saying is that because of Australia has been very lucky in terms of the number of cases we've had with COVID, and that's partly due to our geographical isolation, but also because our governments operated quickly. And also, unlike some other parts of the world, our different levels of government were able to cooperate very quickly. There's been no, even though there are different political parties, in fact, they are quite opposed politically, they managed to come together in the national cabinet and provide guidelines that have enabled there to be a consistent approach across all of Australia. So that's been a big advantage. And finally, as I said, our courts have changed, are going back to work, but I really believe that they are going to, from now on, operate in a different way. They will never go back to the way they were before. Even judges who didn't like technology now see the benefits in change for lawyers and judges in Australia. Thank you, Pak Herman.
Okay, thank you, Mr. David. Okay, that is Mr. David Bamford from Flinders University. We know that COVID is an very expensive disease, right? But a blessing disguise of the COVID is it makes everything new, including the trial and so on. That's good. Okay. Okay. Now we are going to invite the second speaker. That is Dr. M. Trahera from College of Nursing, University of San Lazare, Bacolod of the Philippines. Dr. Trahera, please.
Good morning, everyone. I'm Dr. Sheila Trahera from University of St. LaSalle, Bacolod, College of Nursing, and the Center for Linkages and International Affairs. Our school is founded by the LaSalle brothers in 1952 by three American brothers under the Philippine province. Brothers of the Christians. An international institution dedicated to human Christian education of the young, especially the poor. So this morning, I'm going to share with you strategy and in handling COVID-19 experience sharing from the Philippines. Next slide, please. Today's sharing will cover current issues related to Philippines' general strategies and policies in handling the pandemic. special key measures that are being taken in the Philippines in protecting particularly the healthcare workers, as I was assigned being a nurse, and the efforts and challenges faced by healthcare workers in the Philippines, including particular policies made by the government for protecting them. So the spread of COVID-19 pandemic in the Philippines started or was found out January 30, 2020, when the first case of the disease was confirmed in Metro Manila. It involved a 38-year-old Chinese woman who was confined in San Lazaro Hospital in Manila. Then we started to actually address since more cases are actually found. Next slide, please. So here are the highlights and recent updates on COVID June 3. Last June 3, we have 19,748 total cases. These are validated cases only in relation to the 27 plus last June 4. However, as of yesterday, we have an update that there's already about 20,000 plus cases. Okay, as you can see in the screen. So we have 4,153 recoveries. About 974 died. This is as of June 3. And we have also in here active cases of 14,621. And we were saying that 14% of these are actually healthcare workers. Next slide, please. Next slide, please. Okay. The Department of Health recorded actually, in this case, we have 2,703 healthcare workers were found to be with COVID-19. And with that, they were saying that 1,206 are actually active, and recoveries are, as of now, 1,465 and getting better, with 32 deaths. In line with that, we have the so-called the Bayanihan to Heal as One Act, which was okay. Good morning, everyone.
Okay. Okay, please go on. Okay.
Do you want me to repeat? Okay, so I was saying, good morning, everyone. I have given you already more or less the highlight of what are happening now in the Philippines. For the case summary, I was telling you a while ago that as of June 3, there were actually 19,400 or 748 people who were actually affected by COVID-19 as validated, compared to the suspected one of 27,000 plus. As of yesterday, June 5, 4 p.m., we have actually an update from the Department of Health, which reports that there is actually a total of 20,000 626 were already affected. With that, I would like to highlight that out of the 14,621 cases, 14% of this is actually or are actually healthcare workers. And with the 974 deaths, 32 of which are actually healthcare workers. Next slide, please. Okay, so in this case, if you have heard about the previous discussion, the 14,621 cases had 32 deaths, and those are actually our healthcare workers. 14% or an equivalent of 1,465 of them are actually able to recover. And I have mentioned about the 32 deaths because as of now, our president, through the Bayanihan to Heal as one app, which is officially designated as the Republic Act number 11469, which I'm going to mention later, is a law in the Philippines that was enacted on March 2020, granting the president additional authority to combat the COVID-19 pandemic in the Philippines. The word bayanihan is a Tagalog word for communal work. And so with this, it authorizes our president to exercise powers necessary to carry out urgent measures to meet the current national emergency related to COVID-19 only for 3 months. So now we're actually into the Bayanihan to Heal as one act in terms of, and they're trying to have it, the recovery, Bayanihan to recover as one act. Okay, anyways, to continue, next slide, please.
Okay.
So, if you will notice in the figure, you will have in there healthcare workers with almost 83.17% having mild symptoms. And that 2,703 of them are actually found to be with active cases. So among them, if you will notice, the nurses, top 993 with a total of 4 deaths. Physicians with 736, but with the highest death, which is actually 26. Well, I was mentioning the Bayanihan Act a while ago because at this total deaths from our health workers will be remunerated according to the Bayanihan Act of 1 million to be given to their family as a support from the dedicated life by our healthcare professionals who died from COVID-19. We have also to look into the figure wherein 202 or 16.75% are symptomatic, and that we have to realize that we have to be extra careful because since a lot of people are actually still having mild symptoms and therefore could not be actually sensed, they could roam around and still infect others. So we have to still follow the social distancing, the wearing of masks, and other protocols. Next slide, please. Okay, so we have here the shortening duration of infectiousness by the DOH with the flattening of the curve. So now Dr. Harris' discussion on the flattening of the curve could be sensed already in the figure by the DOH. If you will notice, there's a decrease already in the number of incidents, of healthcare workers with confirmed COVID-19 by date of onset of illness from the 2,700. So in this case, you can see in there the healthcare workers incidence rate as well as the non-medical. Okay, next slide, please. Okay, so in here we have the goal, which is of infection. We are able to achieve already the flattening of the curve. That means our healthcare facilities are able to actually control the incidence of COVID-19 cases. So just to give you the data as to age and sex distribution of confirmed cases, you will notice that there are actually more males who are affected by COVID-19. This could be attributed with that of the tendency of our fathers mostly, or male representative of the family looking for something for the family to for the economics. So they go out and are exposed in the social places. So most of the confirmed cases are actually male. If you will notice, most cases also are within 20 and 27 cases, okay, 10 female and 17 male with unsuspected or unspecified age are included in the total. So the average hospital length of stay for recovered patient is actually 17 days. However, our quarantine day is only lasting for 14 days. And a total of 485 or 40 or 50% deaths had known comorbidities. And of course, these are hypertension, which is 291, actually having a data of 60% of the total cases, and diabetes, which is actually 223 or 46%. Now, if you will notice, these comorbidities are actually also inclusive of or are identified actually as chronic diseases and are common among elderlies. Hence, these people, elderly, and those uh, young people 20 years old and below are actually not allowed to go out because the immune system is not actually uh, well in possible.
Hello. Sorry.
Yes,
Sorry
next slide.
for the. Okay. Sorry for the disturbance again. No,
I
no.
would like to,
Yeah. Go on, please.
next slide, please. I would like to have the next slide. Okay. So, common problems encountered by nurses, which were also addressed by the Department of Health. This is actually from the PNA report on COVID-19, which was shared by Ms. Maribeth Marshall, the chief nurse of our top hospital here in the province. So, number one, the need for complete PPE, or personal protective equipment. Second is lack of manpower, long hours of work, transportation to and from the hospitals and stations near the residence of the healthcare workers. In line with that, our university actually have this initiative, had this initiative to actually offer our health and science campus for the nearby regional hospital for their health workers to actually stay as a temporary shelter, as well as our Balay Kalinungan to shelter another affiliating agency, the doctor's hospital. Their health workers could stay there as a temporary shelter. And also accommodation, if possible, to contain and confine the virus and to give more time for the healthcare workers to rest after duty hours. So this was actually made possible by allowing the healthcare workers to actually stay in nearby shelter. So the practice here in our regional hospital is that all healthcare workers are actually were assessed whether they could be exposed in the COVID unit, and all those who are physically fit are actually given the chance to care for our COVID patients or for 14 days. So after the 14 days, they will have 7 days off for quarantine, and after 7 days, they will be checked again with rapid testing, whether they are fit to go back to their mother unit for duty. And then we have in here humiliation and discrimination because people fear to be infected if they meet any healthcare workers. So there were incidents of actual harassment among our healthcare workers, especially those wearing the white uniform. But this was addressed by our government. Also, black to end from work and testing of healthcare workers, which is actually being undertaken. Now, the target of our president now is actually to increase the testing of 50,000 people in a day. So if you will notice in here, we have here 389,000 plus people already tested. And we have there about 7.3%, which is found to be positive. Next slide, please. Next slide, please. Okay, so these are measures done in the protection of the medical healthcare workers. We have the Bayanihan to Heal as act as one act. This is again, as I mentioned, an effort by our country in order to actually authorize the president to exercise powers necessary to carry out urgent measures to meet the current national emergency related to COVID-19. This is only for 3 months. So now we are already into the Bayanihan to recover as one act. So with the lessened number of incidence rate. Well, in line with this, these are measures in the protection of medical health workers. From the Bayanihan to Heal as one act, again, the enumeration were given to those people, to those health workers who dedicated their lives and died during the COVID-19 pandemic. In fact, to June 9, for the fund of 1 million to those who died in the pandemic, the healthcare workers. And then for those who actually are were infected by COVID and developed severe symptoms, they are to be given 100,000 pesos as compensation. And also there were increase in remuneration aside from hazard pay, among others. So we were also giving support to our healthcare workers in terms of their mental health. And at the same time, if you can see, there were a lot that were done so that they will be protected, like support in the giving of PPEs. So with this, next slide, please. Okay, so the goal now is to enhance quality, consistency, and
Would you like to shorten it because of time?
yeah. Okay. Of your provisions, if you will notice, these are actually the different helmets to the health workers. So coveralls, face masks, gowns,
Pakai seluar.
head cups, goggles, face shields, aprons, sanitation tents, thermal scanners, and a lot more. Next slide, please. Okay, so we have here, if you will notice now, as of June 3, hospital beds and mechanical ventilators dedicated to COVID-19 patients, there are a lot of beds available, okay, ward beds occupied, from 1,965, only 1,048, and from isolation beds occupied, only 3,000 out of 6,000. Same is true with ICU beds, from 1,000 plus, available is 476. And also from mechanical ventilators in use, from 1,601 available, we have the only one used are 356. Next slide, please. Next slide, please. Okay, so now us we have to increase resilience, stop transmission, and reduce contact. So the new normal with minimum health standards, it has been asked to follow simple precautions that will reduce exposure to COVID-19. Taking care of ourselves is also equivalent to taking care of our families and communities. We also have to observe hygiene, proper coughing manners, wearing face masks and other PPEs. And if possible, studying should be done at home and maintain a healthy lifestyle to bolster immunity against diseases. Preparing healthy foods, exercising regularly, and avoiding unnecessary smoking. Next slide, please. Next slide, please. Okay, so we have here our healthcare workers. Our Department of Health is telling us that with minimum health standard, everyone is actually enjoying and appreciating frontline healthcare workers as they work tirelessly to battle the disease on the front lines while the nation stays safe at home. Support and kind words to go a long way to keep us the spirits of our modern day heroes, who are our healthcare workers. Next slide, please. So thank you, everyone. The DOH, USLS, SCU for the invitation. The DOH, CLMR, HTGL, TLJPH Hospital, and their staff nurses who actually model. Center for Linkages, Dr. Valor, Dr. Reyes of DOH, Dr. Marcella, my classmate, Miss Marshall, the chief nurse of CLMRH, Dr. Belan of the graduate school, Michelle Pacheco from TLJPH, my boss, Dr. Babsi Bergante, and all the participants who listened patiently in this presentation. Thank you very much.
Thank you, Dr. Prakira. It's interesting experience from the Philippines. Now we are to invite Dr. Endang Wahyati from Sukio Pranoto Catholic University. Dr. Endang, please.
Okay, thank you, Mr. Moderator, Professor Bamford, Dr. Sila, and Dr. I'm glad to see you in this webinar. All participants, how are you? In this webinar, I will present about a problematic of COVID-19 countermeasure policy in Indonesia. Maybe the slide still preparing. Okay. Okay. The topic is a problematic of COVID-19 countermeasure policy in Indonesia. Next slide. COVID-19 case was officially announced on March 2nd, 2020. Since then, the number of the infected increased and widely spread. It happened in 34 provinces or all provinces and more than 400 districts and cities in Indonesia. Next slide. Okay. Okay, the picture shows the spread of COVID-19 on 4th June 2020. Okay, next slide. Yes. Principally, Indonesia was not late in handling the disease because it has had already legal instrument dealing with infectious disease before COVID-19 arrived. Some of the instruments are: 1. Act number 4 of 1984 on plague infectious disease. 2. Act number 36 of 2009 of health. It has completed by Act number 6 2019 on health quarantine. Next. Special for COVID-19, some policy instruments were made. Seen from the number, there are quite many and various policy instruments. made by different government institutions, both central and local district. Okay, next. Herewith, the basic legal instrument made by the central government. Any operating regulation should be based on this instrument. The existing legal instrument include acts, government regulation in lieu of act or perpu, government regulation, presidential decree, presidential instruction, etc. Some example of the instrument are: 1. Act number 4 of 1984, 2. Act number 36 of 2009, 3. Act number 6 of 2018, 4. Government regulation in lieu of Act number 1 of 2020 as has been declared to be Act number 2 of 2020. Next slide. We are very sorry for the disturb with the internet connecting. Okay, next slide. Okay, I will continue my presentation. Presidential Decree number 9 of 2020, 5 Presidential Decree number 11 of 2020, and Presidential Instruction number 4 of 2020. Next slide. Okay. Political regulation issued by various institutions, ministry offices, an example, industry, health, finance. Okay, I will continue my presentation. Outside the legislation above, some other institution also made regulation based on their institution interest. An example, in ministry offices, industry, health, finance, trade, domestic affairs, and so on. Other institutions such as Central Bank, Financial Services Authority, BNPB, National Disaster Management Authority, and so on. Regulation at the level of provinces, districts, and cities were also made. political regulation issued by various institutions. Next slide. The form of the instrument are regulation, decree, circular, even in the form of press release. All the regulations are intended to prevent and countermeasure the plague of COVID-19. When COVID-19 was firstly detected in March 2020, the government soon made some protocols covering health, communication, public, and even of school areas protocols. These all are named policies or billets. Next one. This proves that every effort has been done by the government to handle the pandemic so that it will prevent from severe impact. The goal of policies is people's safety in their multiple aspects on life, not only health, but social, economic as well. Based on my explanation before, the problem is, next slide. Why the plague of COVID-19 could not be effectively handled? It is because the COVID-19 problem in Indonesia are too complex. The policies could not be simply implemented beside of some difficult and dilemma choices. Next slide. Comparing with other countries, some countries had lockdown policy, but Indonesia did not. Actually, the Act of Health Quarantine regulates about so-called region quarantine. It has the similar meaning with lockdown, but Indonesia did not make the policy. Indonesia took a softer policy named large-scale social distancing or PSBB. This policy is even not applied for all regions of Indonesia. Next slide. Why Indonesia did not take lockdown policy. In legal making process, we should consider many aspects, namely philosophical, juridical, sociological, and even technical consideration based on every country situation and condition. This leads Indonesian government to make different policies based on Indonesian specific situation and condition. Next slide. When we talk about policy, we must know what policy means. A policy is whether government choose to do or not to do. It is a tool to make a social order and a tool to provide prosperity. Therefore, a policy is legal conduct. Next slide. COVID-19 countermeasure policy in Indonesia. The government has made and implemented quite many policies in handling COVID-19. The objectives are to prevent the transmission of COVID-19 and to cope with the disease. The policies are indeed discretionary. The policy-making process is based on the existing problems and specific characteristics of Indonesian communities. Next slide. What the discretionary policy in Indonesia? Discretionary policies were made because the problems are complex and they relate to each other. COVID-19 does not deal with health only, but it relates to economic, social, political, cultural, and even religious matters. Next slide. So the question is, why is not lockdown? there are some consideration. There is no region having capability to be a self-supporting region. There are certainly interdependent relationships of the region in various sectors, such as food as primary need, transportation, manpower, etc. Next slide. And the other reason is many people work at informal sector. They are from hand-to-mouth economic tools. They rely on daily wages. In lockdown policy, the government is obliged to provide the basic or primary needs of the people, and this will be difficult to fulfill. Next slide. And then an example, another example in prohibition of returning home during Eid al-Fitri or Mudik. Why? Mudik is a cultural happening for all Indonesian people, but it is prohibited this year because it will potentially increase the transmission. And the other reason is more than half of Indonesian people live in Java. Java is then to be the most crowded island. This situation will make COVID-19 easily spread out. Next slide. In handling the pandemic of COVID-19, we face some obstacles. As a dangerous infectious disease, COVID-19 should be treated with caution. Health protocols should be done. Physical distancing, hand washing, and wearing a mask, and so on. However, many people tend to ignore because of low discipline. Some even have a view that the disease comes from God, and God himself will handle it. Next slide. And the other obstacles, the act obsolete, out of date. It was issued in 1984. It could not accommodate the present plague, including COVID-19. Law enforcement has not been maximized. Even it tends to be endowed so that there is no different effect, no deterrent effect. Next slide. And the other obstacle is less coordination between the central and regional government, among the ministries, offices, and between one institution and another. This makes the people confused. The availability of human resources and fund is still limited. Okay, and the conclusion of my presentation is in the next slide. One, the transmission of COVID-19 in Indonesia continue to increase both the number and transmitting areas. There are many policy instruments, some any unsynchronized. COVID-19 remain facing some obstacle from different aspects and makes the law enforcement not maximum. Okay, the next slide. Our recommendation is one, more intensive and serious coordination is needed so that there are synergistic steps and people will not be made confused. Two, the government should more focus and be strict in implementing the regulation. And the last, continuous civil education in facing COVID-19 is okay, participant. That's all my presentation. Thank you.
Thank you, Dr. Enang Wahyati. Now we are coming to the last speaker, namely Dr. Shi Chia-Ri from School of Law, Tonghai University, Taichung, Taiwan. As we know that Taiwan has a success story dealing with handling COVID-19. So we are going to listen to Dr. Shi. Dr. Shi, please. Hello, Dr. Shi. Are you listening to me?
Yes. Yes. Hi.
Okay. Okay.
Okay.
The turn is yours.
Thank you. Good morning, moderator. Good morning, all the speakers, and good morning, all the audience. Nice to meet you all online. It's my pleasure to be here to introduce our success story. And we have to be very proud. Taiwan has been doing very well in terms of the handling the COVID-19 experience. Today is my pleasure to share my story with you. Next slide, please. So today I would like to start up on my presentation to introduce you how we deal with COVID-19 and our success story so far. And also I would like to cover what's our strategy and our government's framework in order to control such a huge pandemic. And also we would like to introduce our legal infrastructure that can support the government's effort that can contain such pandemic. And then finally, I would like to explain and then introduce how our country implement all the pandemic control measure in order to make ensure and also obtain such a successful result in terms of contain the COVID-19. Next slide, please. So far, Taiwan, as it occurred today until today, we only have 443 confirmed cases. Within these 443 confirmed cases, there are 352 coming from overseas infected cases. Prepare ourselves to combat this COVID-19 so that we can successfully to stop the spread and then protect our nations. Excuse me, can you put on the slide?
Hello, excuse me. We have a disturbance just now. Would you like to repeat for a while about your presentation? Not all.
Sure.
Please, yeah.
Yes. So if you look at our yes, if we look at our number, our number 443 cases is relatively lower than any country around us. And as Johns Hopkins University in the United States used to predict, Taiwan could be the one of the hardest hit country in the world because we have such a frequent travel and a close tie to China. But luckily, because our government took a very successful measure and also the very position ourselves to prepare for such a pandemic. So our confirmed cases and the deaths is relatively low. So far we only have 7 death cases, and then the total number of recovered cases is 429. And as today, we don't have any locally infected cases since April 12th. And we don't have any infected cases from overseas for quite a long time. So for us today, we can still, as we look at the world around us, that Taiwan actually we haven't experienced any lockdown. And then I have a kid who is a 3rd grade who's still going to the school, and then our compared to any other country, we have a lower cases, and then we have less deaths, and then we can still maintain somewhat normal life, and the kids still go to school, and then people's social life still going on. I think it's all because of the four important strategy. The first one is strong awareness and preparation. Our government become aware of this issue in the very early on, so preposition and also prepare all the nation for such a control. And second, the government actively prepare the legal framework that can support all the government action that could have to all the measure that we were going to take. And the third, we have a very comprehensive health network and a supporting system. As most people might know, that Taiwan has a national health insurance system. Through the national health insurance system, we can implement the tracing, we can implement the contacts, and we can also implement the major control. And then fourth, we have a very strong community and a civilian cooperation and compliance. Most of the civilian and most of the citizens in our country, we comply the government's guideline very, very comprehensively. And the most important thing is that I think government get a very good public education, and then promote all the measures, and then make all the civilian is more willing to adapt such a measure and voluntarily to comply. Next slide, please. So in terms of the first factor that create is because our government and our civilians are having a strong awareness and preparation. As early as January 7th, our government already listed Wuhan as a high-risk city for travels. We already begin to aware of the problem could occur. So we start warning our citizens who ever travel into Wuhan or to China should be taking extra careful measures. And on June 12th, 2020, in order to be aware of, in order to understand what's really going on in Wuhan, our government sent a medical expert into China to investigate what's the COVID-19, or what this, at the time, they haven't been named as a COVID-19 a disease, and then try to understand how it be infected, how's the cause, and how can we take any measure to contain it. So on June 20th, 2020, so our government already established a central epidemic control center, and it began a daily briefing. Our government understand that based upon the investigation that this disease will be contagious and it is highly infectious. So we would like to our citizens to be aware of it, and then start to take in a preparation, and then prepare all the nation for the pandemic. So as we establish this CDC center, the daily briefing give all the citizens a very good information. It report all the measures we should take, how we should wear masks, how we should wash our hands, how the school should be careful about how to gather with the student. And then so all the nations start to prepare for such a pandemic. On June 23rd is actually the Chinese New Year Eve. The government immediately banned all the direct flight from Wuhan to Taiwan. And also, meanwhile, the government realized that because Taiwan is such a small nation, we have limited resources. We need to ensure all our medical equipment and all the citizens would have sufficient protection gears. So on June 24th, the government already issued a ban for all the exportation of all the masks and all the PPE, and it has prepared to production sufficient PPE for all the medical workers. And on June 21st, we established the cloud database through the Taiwan National Health Insurance System in order to chase all the possible infections. In Taiwan, because we have a national health system, so majority, basically all the citizens are joined the national housing system. In national housing system, they will be able to trace all the citizens have been to overseas and their medical record, and to make sure that we can get all the possible tracing. And on February 25th, the government passed a special law to combat this COVID-19. The Special Act of Prevention, Relief, and the Revitalization, and the measure for severe familiar with the novel pathogens that could allow the government to take any necessary measure to prepare the nation for the pandemic. Next slide, please. From this awareness, you can tell that the government started to make sure that we can have a strong legal framework that can support all the government action they would have to take. So before, in 2003, because Taiwan used to have a SARS experience, so the government at the time already prepared to how to prepare for the next pandemic that could happen. So we have been enacted different regulation and a different law to make sure that the hospital or the government has the disease control plan in case that another pandemic happened again. So on June 19, 2019, the government did pass a Communicable Disease Control Act. Within that act, allow the central government and the local government to enact the plans and implement any necessary measure to prevent the infection and the spread of the communicable disease, including the quarantine plan of how to do the public education, how to do the school education, and then how to maintain the social activity. So they already give the government has such an authorization and also a measure to take. And then due to the COVID-19, on 2020, the government enacted another special act, which is the Special Act for Prevention, Relief, and the Revitalization Measures for Severe Pneumonia with the novel pathogens, that the law provide a compensation to the medical system, because we are aware of in order to combat this epidemic, we need to have very strong medical system to support. And so we will make sure the government will have an appropriate budget to support the medical system. And second, we will have the compensation for any individual who are required to quarantine, so that individuals who need to be quarantined will be more willing to comply. They don't need to be worried about if the financial issues and the food issues, any issue that might affect their quarantine. So in Taiwan, for anybody who doesn't matter, you are a foreigner or you are a Taiwan citizen, if you are meet the criteria to be quarantined, all the quarantine, actually government will pay you daily to be quarantined. And fourth, we have an expropriation of any necessary equipment and the raw materials. The law allows the government to stop any exportation for the mask or PPE, and then to make sure that we can have enough supply for our nation when pandemic occur. And also we can prepare that we have a sufficient supply even further on. Next slide, please. So because of this, because we have established a strong legal framework, so that allowed the government started taking into the action to make sure that all the nation has been protected from this disease. So we have a comprehensive health network and supporting system. In the health system wise, because of the law and because the government has prepared in advance. So our national health insurance play a very, very significant role because of the early preparation. So our national health system has a sufficient supplies, and then we already have a designated quarantine facility. So in Taiwan, if any confirmed cases, you will be able to put it in a special quarantine facility in the hospital to be to provide a great care for all the patients, and also ensure those patients will not have any opportunity to infect other people, so we can contain the infections. And also the government have a very specific plan in terms of how to stop the spread. We established a 3 level of quarantine systems. So the government very clearly lay out who has to be in, we have 3 different levels of quarantine. The first one is self-health management, which means that if you have any chance to go to certain tourist spot or like the places that could contain a lot of people gathering, then the government will issue the warning to you, and then you will have to watch your health situation every day. For example, you will have to take your temperature for 14 days, and to make sure you have any symptoms. And then if you have any symptoms, the government will provide the opportunity for you to be tested. And the second, that is self-quarantine systems. So in the self-quarantine system, that means that if you have any contact or you're coming from overseas, that's a country that could be have a high infection, then you have to be self-quarantined for 14 days. Within these 14 days, you will have to be stay at home. You have to, the government will have designated personnel to interview and then make sure you are in a good health. And then also they will make sure that you are in a self-quarantine stage. And then also you will have not violate the self-quarantine, like you're not going out to affect the chasing or any like have any contact information. And then the very last one is a mandatory quarantine systems. The mandatory quarantine system actually is that if you have a contact histories, and also you would be in the as a confirmed cases, the government mandatory quarantine systems. In the mandatory quarantine system will be in the hospital, and there will be in the very well taking care of the system that make sure that all the patient could get the best treatment. So in addition to this 3 level of quarantine system, our government also provided a strong local community network and support. In the local community network, we have all the villages, all the local governments. They will have establish a contact tracing network. The contact tracing networks allow that each county, each village would have the designated person to make sure that whoever in the quarantine in the districts will be tracing, will be ensure they have a food, they have a community care system access. They will be able to provide them with anything they need for the life, for the daily life, so that they can stay in quarantine. And also because of the local community network is closely monitor all the quarantine personnel, so we can stop the spread for all the other disease. And so in addition to that, our government also have the infection protection and national mask systems. In the early stage, we discovered that mask would be essential for preventing from the spread, because the study shows that once you wear the mask, the chance for you to speak or to translate the virus, and also the chance for you to touch it is significantly less. So the mask production control expansion, the government start to control. We know that we have a very limited resources in terms of mask production. So the government start to expropriate the mass production and then start to spend, we establish our own production line and spend the mass production to ensure everybody in Taiwan would have the mask. And second, we will have the medical protection. And we can control the price and then make sure that nobody take this advantage to have a very high price, so that all the nation could be in the stable situation to have protection gear. Yes. Sorry, I was waiting for the slide to come back. So our national mask system actually played the big role because it's successfully to make sure everybody has protection gear, so they successfully stop the spread and decrease the chance for infection. Yes, and then sorry, good, okay, and then we are coming back to the slide. We're talking about, in addition to our national mask systems, our medical system actually, and our research center developed a very quick testing kits that allow us to, for any possible case, we can do the quick testing immediately, so that we will be able to make sure that whatever can be discovered could be infected, it could be quarantined, or it could be could be stopped from spreading immediately. We also been very successful in terms of the vaccine research and yes. So with all those framework in place, then with all those with all those legal framework in place, we will be able to, our government take several important measures to make sure that all the society can comply with all those epidemic control and the measures. So for example, in the school in all levels, like no matter it's a middle school, elementary school, university, colleges, we establish standard if we find out any cases, how we can stop the spread. For the general standard for the suspending the classes in the whole nation policy, if there's any one student infected, the student and then the whole class will be suspended. If there are 2 students found infected, the whole class, the whole school is closed. So far, Taiwan have one school was closed due to the situation. But because school has such a tight control, and so that all the students are wearing a mask in school, and all the big gathering are suspended, and then we just keep the student, make sure they have a good social distancing, and so that all the school actually still keep going. We don't have to close any other school, and then kids can still go on the school schedule. But the government also want to prepare all the students that in case that infection did occur. So the school in the nation has prepared online learning network, and then we want to make sure that all the students who actually, some students that minority students might not have sufficient equipment, then they will be able to prepare for that as well. So the government plan ahead, make sure that all the students, they have access, no matter to the internet, no matter to any equipment, to be able to do the online learning network in case that we have to close the school in the big scales, and then we will not affect the student, their education. But luckily, fortunately, so far, we don't have to do that. So our school still keep going as the section goes. And so in our school, for Donghai University, take it for example, our schools, all students and faculty have to wear masks in school. And then when we're in school, even so hot, we have to open the windows. So we have to make sure that a class size is limited. If the certain class size is more than a certain amount of person, then you have to be divided in 2 classes. Maybe half of school, half the class can come to the classroom, and half school had to go online. So we do try to limit the person to be in contact. Next slide, please. So another significant public academic control measures is that we have the social distancing guidelines. And we want to make sure that all the public, when they're the interaction in the society, in order to maintain some sort of social distancing, we have very clear guidelines to tell all the nation how to interact with each other. We clearly tell everybody, if you're outdoor, you have to maintain 1.5 meters. If you're indoor, it's 1 meters. So all the shoppers, when you go to the store, they would have to make sure when you check out, you have a certain distance between the customers. And so all the masks are required in all the public transportation. So if you don't have a mask in public transportation, it might be prohibited going to the train station, high-speed train station, or bus even. And we also discourage the social gathering. And then because the government did such a good job in public education, our people voluntarily kind of decrease the chance to social gathering. And then all the restaurants can still maintain open, but the restaurant person required to wear a mask. And then we'll encourage divided working hours for the other companies. We'll encourage them to divide the working hours to limit the people in the enclosed space. And there's a lot of companies have been starting to implement to try to diverse the group of people to come to the work. And then, for example, half will stay at home to work from home, and half will be working at the office. Then gradually decrease the people to contacts. Also, we have a limitation on the visitor to high-risk facilities. For example, hospital, nursing homes. We will prohibit for any any visitors. And then we also suspended high attendance religious activity. Like Taiwan has a very famous religious activity that going on every March. That basically will around Taiwan every year there will be more than 10,000 of people attending the event. So this will be the first year that actually just suspended, just to ensure that public infection won't occur. Next slide, please. So today is our short presentation because our government, I think, our successfully due to our government prepare our nation in a very early stage. In the early stage, we understand we need a strong legal framework to make sure that we can take any necessary measure, no matter from the public standpoint of view, no matter from the school, from every level of our life. The government prepare the nation to work together to cooperate and to combat this severe COVID-19. And then I think due to the close compliance between the government and all our nations, so that could create such a successful story. So we will be very happy. And then now Taiwan not only is capable to take care of ourselves, we also have additional medical equipments and to help any other nations. So our government have been donating the medical supply to do our comply our responsibility to the world. And then it's my pleasure to be here today to share our successful story with you. Thank you so much.
Thank you, Dr. Shi. There are some written questions entering, and I would like to read some of them. The first question I will write it from for you all the speakers. It is from Mr. Ismar Toyo of Juanda University of Bogor, West Java. He asks you all. Just now we talked about states policies in every country. The question is about what about the contribution of academicians or universities to this? The concrete Flinders did, Tunghai did, and so on. Also, Sukiya Pranoto Catholic University did, dealing with the contribution and the real contribution, the concrete contribution. Would you like to give answer for just some minutes for this from Mr. Bamford? Would you like to give some answer for this? What Flinders give in dealing with this?
Thank you very much for that excellent question. Universities have a very important role to play in the COVID environment. First, in the way they model their own behavior. And because universities are very large employers and influence many, many students. So what we do is important. So in my university, for example, has closed all classes from face-to-face teaching from very early on, and has transitioned everything to online. So all our teaching is online. Even our examinations and assessment is being done by online techniques at the moment. All encouraged, we're told to work from home, and only essential staff had to come to university to their offices. So in our behavior, we have tried to model a good behavior as an employer and as workers. But more importantly, of course, our expertise as academics is being sought by government. And so, for example, many of our medical colleagues are very involved in working on COVID committees and providing policy to government and to authorities on activities. In my university also, we are engaging in a number of trials dealing with either treatments and possible medical solutions to some of the COVID problems. And so that's another very active way. As lawyers, of course, we are also involved because as we've seen from the excellent presentations tonight, a lot of the response requires legal regulation, and how to draft and prepare effective regulation is a very important role. And so many academics are also involved in providing advice or participating in working groups to advise authorities on regulation and policy. And so that's a very important role I think we play. Thank you.
Thank you, Mr. Bampot. What about Saint LaSalle University contributes, Miss Dr. Treasurer?
Good morning again. So our university, as I mentioned, supports all our affiliating agency. Since we have a College of Medicine and College of Nursing, our alumni are in full support of giving quality nursing care as well as medical care to our patients in the community. We also offered summer facilities as a temporary shelter, which to our affiliating agencies for their workers, health workers to actually stay there during their quarantine. And we are actually also trying to have our workforce stay at home. Only those that are working for the important activities in the university are reporting. Also, our students were actually in the graduate studies having their classes via Zoom, and social distancing is actually observed in the university. When we enter, our temperatures are checked. We follow social distancing, and we wear masks. So you cannot enter the university without a mask. And we actually model, okay, the important things that are expected of us. So we will support the prevention and help stop the spread of COVID. I think that's all.
Thank you, Dr. Tahira. Now we invite Dr. Endang Wahyati. What did Sugiyopranoto Catholic University do dealing with this? Please.
Okay, thank you, Mr. Hermawan. I think this is the similar policies in our university. We work from home. Everything is doing by online, and the university provide equipment
My life,
to support everything to obey the rule of the by the government, and many activities Okay, sorry with the trouble of connecting. Okay.
Okay. Good.
Okay, connecting now.
Good.
Okay.
Good. Good.
Okay. Okay, sorry with the trouble of connection. I think in our university, similar with other university, the policies to protect the all of the people in university is made by the university. Everything is doing from home by online, but there are many activities doing like now webinar, international webinar is by online, and the university provide everything to support the people in our university to many equipment provide okay. I'm continue. I think the similar policies and our university, everything is doing from home, study from home, working from home, and but the positive is many activities. Okay, maybe our university is just the same with others university. We are doing everything from home, and more the positive thing is more more active.
Yeah.
Many activity share the like this international webinar.
Okay.
Okay, Mr.
Okay, thank you very much, Ms. Indang. The last is for Taiwan. An additional question for you from someone, I don't know the name, something like this. We are waiting for the progress of research for vaccine making in Taiwan. What about the progress of the vaccine making in Taiwan? Because actually, not only Taiwan but the world is waiting for that. Would you like to answer us, Mr. Dr. Shi, please? Hello, Dr. Shi, are you listening to me? Hello? Oh, enggak masuk ya?
Hello, yes.
Yes. Hello, Dr. Shi.
Hello, yes.
Yeah, are you listening? There is an additional question for you. You know,
Okay.
there's an additional question. Namely, what about the progress of the vaccine making in Taiwan? Because actually, not only Taiwan is waiting for that, but the world is waiting for that. Please, would you like to tell us?
Sure. And then in terms of the first questions, then I think university play a big role in terms of how to assist our government to combat the COVID-19. Like I said, the reason Taiwan can be so successful in terms of the controlling the COVID-19 is due to the government's strong awareness and the preparations. So the preparation requires strong legal framework and also the another policy implementation. The university scholars and researchers played a big role to advise and also to help the government to implement those legal framework. And the second, in terms of research, like your second question, the COVID research, Taiwan have been early on doing a very quick vaccine development. We will be able to survive. Separate the virus, and then also that now we actually conduct, as I know that I have been conducting we can have successfully reproduced the medical medicine, and also we have been beginning the human trials. So we not only have the very fast test systems, I mean also our vaccine is actually have been getting a very successful result. So as far as I know, so far we think it's been doing is proceed to the trial, the human testing so far.
Okay, thank you. Mr. Belfort, David Belfort, there is someone who is eager to know about the condition of the genuine indigenous people. Maybe it is origins. Are there origins infected? Something like this, because people think that the indigenous people of Australia is strong persons, something like this. Would you like to answer this, Mr. Belfort?
Thank you, Pak Herman. And I think thank you, Inang, for the question. Yes, the issue for Indigenous people is very challenging. Of course, some Indigenous people live in the cities and others live in remote communities in the desert or in remote areas in Australia. And those living in remote areas in particular have been very concerned about the possibility of COVID reaching their communities, partly because there's very little medical resources in the remote parts of Australia, but also many Indigenous people have comorbidities. They have major health problems in terms of severe challenges to their health conditions. And so if COVID was to reach their communities, the severity of symptoms could be quite significant and the mortality very high. So they've actually had very strict quarantine around their communities, a very, very strict quarantine, so no one can go in and out. And so far it's been, as far as I know, relatively successful. Of course, there are also many Indigenous people living in the cities, like all the other Australians, and so that they have, again, they have the same risks in terms of contact disease, but they also often have poorer health status as well. But so far, on the statistics that I've seen, there's been no great impact on Indigenous people so far.
Thank you very much, Mr. Bamford. Again, to Taiwan, there is a question. Are you ready to see or to face possibility of second wave?
So thanks for the questions. Actually, our government have been very cautious about second wave, even though we have such a successful stories. And so the government now still, we still have a lot of amazing. We still have a lot of travel bans, so we want to make sure control everybody who come into Taiwan who can be at the airport could be tested. So we will have a very strong border control still so far. But in terms of domestically, we do have those social distancing guidelines to comply, and so even with those social guidelines, our restrictions start to getting more released. For example, the school has been, the government has been encouraging people to travel around Taiwan and then to somewhat going back to the regular life. And so, but even with that, we still proceed with the cautious. So we have a mask on, we still have maintained social distancing, we still have the certain activity being restriction. But so far, Taiwan have been cautiously to prepare for the second wave and for the control, but also we also continue preparing all the medical measures in case that did occur.
Okay. Thank you, Ms. C. I think this is the last written questions I would like to give you. Before that, someone asked Ms. Dr. Trahera from the Philippines. We have the similar situation. I mean with Indonesia. Is the Philippines ready to face or to welcome a new normal period? This is a question for me, Dr. Trahera.
Okay, thank you for the question. I guess Philippines, through our Department of Health, is actually trying to do its best to see to it that we are guarding our people in terms of a possible second wave. In fact, daily monitoring and reports are done by the Department of Health. We are also increasing the case finding through increasing our laboratories. We have now more or less 40 accredited laboratories going 50, so that the earliest time we could detect people who are actually having the virus, the best way that we could quarantine them and prevent them from infecting other people. So that's, I think, one of the tasks we are doing. And also, we are very careful with guarding the people who are coming in different islands. Again, as of now, we are in the general community quarantine, and still uniformed men are actually seeing to it that those people, as I am also into international linkage, and our students coming in from other countries are well screened. Anyone who would come to the Philippines during repatriation are actually being tested immediately, and they are put into quarantine by the government effort. And that once negative, they are actually again sent to the different provinces that they belong, so that once they come in here, just yesterday, and one student who arrived, and he is tested with, again, the rapid testing. There are two testings done here in the Philippines: the rapid testing and the PCR test. So once you are okay, so once you're positive with the testing, you are again on quarantine. But when you are negative, you are sent home and continue to have the 14-day quarantine. So that's how strict we are in guarding people coming in the different provinces. Remember, we have more than 7,100 islands. But in line with the question a while ago regarding indigenous people, in the Philippines, we only have very few of them having that problem of infection. In fact, only those who are going to the urban area were the ones infected, very few. Probably we could attribute this to in here we are asked to have herbs, drink like ginger. So I in my study, in my research study, here in the local IPs group, they are actually fond drinking ginger preparation. So probably that's also one thing that we could attribute um, from not having the infection. So I think that's all.
Okay, thank you very much, Dr. Tahira. I think it's as I promised, we are going to give you opportunity or chance for you to give a question directly, and then would you like to raise your hand if you want to anyone to any participants who wants to raise your hand. Lupita, is it you? Is it, so you think Lupita? Okay. Okay. Lupita is raising your hand. Okay. Okay. Now I give you a chance to give questions directly. Okay. So, Mr. Vicky, please. Okay. Mr. Vicky, right? Unmute. So okay. So I will this one. Okay. Now Lupita. Okay, aku kok Raiso. Raiso unmute ya. Okay. Would you like to unmute your own mic, please? You unmute your own mic. Okay. Okay. Now juga siapa? Lato, you have asked in written, but would you like to ask also directly, please? Would you like to unmute your mic, please? Lato.
Hello.
Hello. Who is speaking? Hello, who
Mr.
is speaking? Oh, Lato, would you like to give your direct question, please? To whom?
I want to ask to Prof. Bamford, sorry. I'm asking about the regulation supporting the medicine on trial because we know that the medicine at this moment, we have no medicine for COVID. So how the regulations role to support this trial? Thank you.
Okay, I think Mr. Bavot and also Mr. Rika and she can answer this. Also, Ms. Endang, please.
Shall I go first, back, Herman?
Yeah,
Shall I
Mr.
start?
Bavot first. Mr. Bavot
Okay.
first, please.
Okay. Thank you, Lata, for your question. I've already put a quick reply in chat to your question. Yes, certainly the issue of drug trials or vaccine trials is very important. We know that all across the world there's much cooperation trying to develop particularly vaccines, and we are all hoping very much that there will be success, not just with one vaccine, but different vaccines. The first set of applications were really to deal with treatment of COVID symptoms. And a lot of the applications were around trying to use existing drugs to see if they will help. And you will know that there's been some controversy around some of the anti-malarial drugs, for example. And some drugs have been found to have some success in dealing with symptoms. The process for them is that, certainly in Australia, there is government regulations governing drug trials. And for example, drug trials have to go through a committee approved by the federal government's agency. And those committees look at the ethics of the drug trials along with the safety and the efficacy of the drug trials. And as I said, I actually sit on one of those committees at the moment, and we've had 5 applications to deal with either treatments or vaccines, and those are rapidly being processed very speedily. So that's the process in Australia, and Australia is being used by many international companies to trial their drugs here at the moment. So we are hoping for success very soon, but only time will tell. Partly because for the vaccines, for example, there are already 8 different strains of the COVID around at the moment. So there's a bit of a challenge around vaccines. But that's the regulatory framework from Australia. It requires approval from a government committee, approved committee. That's my response.
Okay, thank you very much, Mr. Bamford. What about the Philippines drug trial in the Philippines, Dr. Tarhera? Hello, Dr. Tarhera, are you listening to me?
Okay.
Okay.
With regards to the question, our president now is actually supporting developments with clinical trials for COVID-19 vaccines. And in line with that, we have actually involvement in the vaccine clinical trials by the last quarter of 2020 with the Department of Science and Technology. And also, all of the medicines and vaccines that are actually supposedly for COVID-19 are actually endorsed with the Bureau of Food and Drug to check whether they are really authentic and are effective for our people. So we will prevent also damage or other problems that may arise from trying to introduce a vaccine that is not proven to be actually very well in trying to prevent infection of COVID-19. So the Department of Science and Technology and the Bureau of Food and Drug with our Department of Health actually monitor such program in terms of clinical trials before introduction to our people. And in fact, in line with that also, we will not be having and not supporting having classes, hopefully without the availability of a vaccine that will actually prevent infection of our students. That was what was told us by our president. So we are crossing our fingers that we will have vaccines available soon with all these clinical trials done.
Okay, thank you very much. What about Taiwan? Is there anything to tell about drug trial and also the regulation in Taiwan? Hello, Dr. Shi, are you listening to me?
Hello? Yes. Hi. Repeat again. So that Taiwan actually have a very strong control regulation framework for testing the vaccine. As everybody know, vaccine itself is a virus. So for the virus to be tested in a trial, it need a very careful evaluated by the government authority. But as everybody tried to rush to find out the COVID-19 vaccine, our government did have a special a legal framework. For example, we have an emergency authorization, emergency use authorization, and then so that so far we can successfully actually develop the new medication that is called let me find out the name. So so far we has been successfully to figure out to redo the medicine called the remdesivir, and then we can start to testing on the different animal. We finish the animal trial and thinking about we'll proceed to the human trial in August. And so far from the animal trial, it looks very promising. But like I say, that the human testing actually require a safety period, for example, 6 months, to ensure that it would not cause the side effect on a human being. So it required a highly regulated government regulation. So so far the government is trying to see if we can shorten the time in a safety measure in order to develop my vaccine. But hopefully we can get it by the end, as early as next year. So, but so far from what we have so far, it looks quite promising.
Thank you very much. Now we are listening to Indonesian experience dealing with drug trial. Ibu Dr. Endang, please.
I think in Indonesia, sorry. Yes, I think in Indonesia the research is ongoing, but the regulation is not yet developed well, and this is the weakness that the law and the condition is not going through together.
Okay. It's enough way. Yeah, Indonesia has some trial, something like plasma therapy proposed by a doctor, Dr. Monica, and also some speculation dealing with, for example, quinine, and so on. But there are also warnings from medical doctors that it is not correct. Okay, I think we have been a quarter past 12. The last questions. Okay, I think we are going to stop this webinar. We are very grateful for your participation, and before we stop, we are going to listen a brief speech from our dean, Dr. Marcella. Dr. Marcella, please.
Okay. Okay, ladies and gentlemen. Okay, colleagues, friends. I know that in quite some time the internet connection is not quite good. Actually, we already prepared everything, every IT procedures necessary, yeah? But the internet connection is sometimes unstable. I don't know why. There are also two IT staff with us here from the morning. So on behalf of the committee, on behalf of the Center for Health Study and Faculty of Law and Communication, I want to say sorry again for this inconvenience. I'm not an IT expert, but maybe because the participant is maybe on and off joining the webinar. So hopefully the whole seminar satisfied you, I know. And maybe for the last information, we are going to send the participant the certificate, and also, of course, I want to thank you. I want to thank Professor David Benford from Flinders University, and Dr. Shi from Tsinghua University. I've been there for 3 months. I was very happy, and I also have been in Australia actually for 3 months, mentoring by Professor Benford. And for all the participants, I also thank you very much for your participation, and I hope we could see you again in some seminars. Better, yeah, better, not sometimes unstable, yeah, with unstable internet. I think that is all, and I will.
Okay.
And maybe I have one announcement. Yesterday we have one of our colleagues passed away. So yesterday was a very difficult time for us. Having this webinar, and also having one of our colleague, yeah, our very close colleague passed away. That's why I'm very sorry again for this inconvenience, and thanks again. I will give this time to the moderator. Thank you all. Bye-bye.
Okay, thank you.
Bye-bye.
Thank you, Dr. Marcella. Again, I would like to thank you for all you, especially Mr. Bamford and Dr. Sheila, Trahera, Dr. Shi, and Dr. Endang. You have given us a good contribution and big contribution. We do expect that our webinar will be very useful to handle the COVID. Now we are facing a new world war, namely World War III, whereas the enemies are invisible. It is our concern, the world concern, global concern. So we are going to fight together. Okay, see you again next time in the webinar. And thank you again for your participation. Hello, Da. Okay, thank you very much for your food. Thank you. Thank you very much. Thank you. Thank you.
Thank you.
Okay. Hello. Thank you. Okay.
Thank you very much.
Thank you, everyone. Goodbye.
God bless you.
Thank you.
Bye. Thank you.
Bye, Dr. Shi. Bye, Dr. Bamford.
Bye. Bye-bye.
Bye, Dr. Wayati.
Bye, Dr. Sheep. Bye, Dr. Trahera.
Goodbye,
Bye-bye.
Marcella.
Bye, Sheila.
Thank you
Bye,
for your
Ron.
Bye, Marcella.
Thank you so much.
Thank you for the invitation. Thank you, everyone, for your kind
Yeah.
attention.
Yeah, thank you for
Thank
everything.
you.
Thank you for everything. Yes.
Thank you. Thank you.
Thank you for everyone.
Ada yang ini.
Ya, kalau di sini bisa ngomong nggak? Bisa. Oh, ini speakernya nggak ini tahu. Iya, nggak tahu mencetnya di mana.
Thank you, Doc Shi. Bye.
Bye, Kim. Thank you for attending. I was looking at the name.
Aduh, mantap kali.